So let me introduce our next speaker, Professor Bettina EVIO. I hope I haven't got your name wrong. She's a full-time faculty at the College of Nursing at the University of Philippines, Manila. She coordinated many health missions in disaster events in Philippines, such as Typhoon Haiyan and the recent volcano eruption in 2020. Professor Bettina also had a research interest in validating competencies and capacity development in DRR and also management DRM, and also resilience and climate change and developing innovative learning strategies and best practices for disaster nursing. So we will play the video very soon and then followed by a live Q&A with Professor Bettina.
Morning, good afternoon, and good evening to all. Thank you for that kind introduction. I am very grateful for having this wonderful opportunity to share with you through this conference our case study on a nursing training program in disaster management in the Philippines. The program, which ran from 2010 to 2017, was made possible through the Philippine Nurses Association, recognized by the International Council of Nurses. I will be sharing with you the development of the program from inception to implementation. At this point, please allow me to acknowledge the other members of the team. Dr. Sheila R. Bonito, currently the Dean of the College of Nursing, University of the Philippines, Manila, and Assistant Professor Christine Joy Tomanan, also faculty of the College of Nursing, University of the Philippines, Manila. Some declarations before we proceed. This report constitutes one of the case studies in the WHO-funded project, Health Workforce Development Strategy in Health EDRM, evidence from literature review, case studies, and expert consultations. The authors of this case study, Dr. Sheila Bonito and myself, were part of the Disaster Preparedness Committee of the Philippine Nurses Association, which initiated, developed, and implemented the training program. The case study did not receive any external funding, and the views expressed in this case study are those of the authors and do not necessarily reflect the position of the Philippine Nurses Association. Some background about the study and training program. The frequent occurrences of natural disasters and their consequent effects on societies and the lives of many people demands coordinated efforts from different sectors, particularly in health. Given its geographical location, the Philippines has experienced numerous disasters, both from interaction with natural hazards and also from complex disasters. The Republic of the Philippines is an archipelago in Southeast Asia situated in the Western Pacific Ocean and consists of about 7,640 islands that are broadly categorized under the main geographical divisions from north to south, and these are Luzon, Visayas, and Mindanao. Given the number of disasters that has occurred from the years 2000 to 2020, the Philippines ranked fourth in the number of disasters globally. These two images show the summary maps of the tracks of all tropical cyclones in the Pacific typhoon season, one of 2013 and the other of 2020. Majority of these tropical cyclones passed through the Philippines. You could hardly see it in the maps. One reason why we experience many devastating typhoons in the country. The following are some of the major frameworks that guided the development of the training program and the case study. The HYOGA framework for action, the Sendai framework for disaster risk reduction, health emergency and disaster risk management framework, and what is common among this is the reference to health workers' education and capacity building in establishing resilient health systems. The International Council of Nurses points out that broad, nurses' broad caregiving skills across levels, their creativity and adaptability in life situations, as well as leadership skills, which can be applied in a variety of disaster settings and situations, makes them easily be called upon to serve as health frontliners. And however, we are also cognizant that disaster nursing is a relatively new specialty field. There are barriers, gaps in knowledge and in field preparation, which may hinder nurses' effective participation in disaster management. That is why we need training and education in disaster management. Please allow me now to present the objectives of the case study. The first is to present the contributing factors that rationalize the need for a national training for nurse volunteers in disaster management in the Philippines, to describe the development and implementation of the national training for nurse trainers and volunteers in disaster preparedness developed through the Philippine Nurses Association, to discuss nurse volunteers management in terms of certification and accreditation, safety and security, collaboration and networks in the Philippines, to describe the impact of the national training program on Philippine nurses' competencies in disaster management, and to propose recommendations based on the case study analysis and results. Now I will give briefly an overview of the nursing practice in the Philippines. A study on the workforce in the Philippines involving 90,308 nurses based on the 2017 data showed that majority of these nurses, or 74%, work in hospitals, while the rest are in the community or field. Graduates of the Bachelor of Science in Nursing program take the nurse licensure exam. They are considered generalist nurses who can practice in any field of nursing after obtaining their professional license to practice as registered nurses under the Philippine nursing law. There are no current provisions for a formalized advanced practice in nursing, but we are moving towards that direction. What we have for the moment are clinical nurse specialists who go through a credentialing process in order to be certified in any of the 15 selected nursing practice specialties. The list of nursing specialties for certification include emergency and trauma nursing. However, there's no specific certification for disaster nursing. Disaster nursing, the Bachelor of Science nursing program, is just recently included as a separate major course in the curriculum. At the time the training program was developed in 2010, there were other training programs on emergency and disaster nursing, but there was no evidence-based literature to support a competency-based framework as proposed by the ICN and that covers the roles of nurses across the disaster continuum. While most training programs focus on disaster response skills and interventions, PNA's program introduced nurses to competency building across the different phases of the disaster management, guided by the ICN framework on disaster nursing competencies that was published in 2009. Now, we will look at the key discussion points of the case study. So the first would look into contributing factors that rationalize the need for the training program. Some of the major points were already presented earlier, such as the frequent occurrences of natural disasters in the country. There are barriers that impede nurses' active participation, including their willingness to be deployed in disaster events, as pointed out by ICN. And what are these barriers? The lack of accepted competencies, gaps in education, the lack of awareness of opportunities for training and collaboration, and the lack of clarity of their roles in disaster management. Some literature also point out that there is a lack of awareness of disaster management protocols in their workplace. A lack of prior experience and training in disaster management limit nurses' participation. They find themselves organizing or providing health services, initiating calls for donation, and providing disaster relief goods in evacuation centers. But we all know that Filipino nurses can do more. The PNA leadership realized the challenge and need for a more proactive approach to disaster management, thus the National Training for Trainers in Disaster Management. Now we will look at the training programs development and implementation. So the Committee on Disaster Preparedness of the PNA was tasked to craft a training program that will prepare nurses in disaster preparedness and management in order to transmit to their fellow nurses a similar training program or, when required, to mount a disaster response according to the specific need of their local community or neighboring communities. The training program is designed as a continuing professional education program for nurses. It has the following main components: the instructional design, the program budget and resources, including persons, personnel, and facilitators, and resource materials, the target participants, and the program activities and program evaluation. These were needed to comply with the requirements for program accreditation as specified under the Philippine Nursing Law. The instructional design used an outcomes-based approach in formulating the program outcomes, which guided the selection of the topics, the choice of learning strategies and activities, including the resource materials and training evaluation. In this slide, we see the main framework that guided the choice of program topics or content. And these were based on frameworks such as the ICN Disaster Nursing Competency Framework, the Asia Pacific Emergency and Disaster Nursing Network Ecological Framework, and the Interagency Standing Committee Cluster Approach. The ones highlighted in red are the specific topics that were tackled in the training program. These were identified as the areas where nurses need more information and knowledge and skills development. As for the program activities and program evaluation, a variety of learning strategies and training activities were included to ensure active participation of attendees, provide opportunities to practice skills, encourage reflection on concepts and practice, and promote critical thinking skills through opportunities that mirror real-life scenarios. This included interactive lectures, videos, skills laboratory practice and return demonstration, case scenarios blended with tabletop exercises, and role play covering specific phases of disaster management, which are common or innovative teaching strategies used in nursing education. In the slide, you will see the pictures, some pictures that were taken during the training program. And as you can see, we try to ensure that the participants play very active roles during the training program in sharing their skills in disaster nursing or demonstrating their roles as learned in disaster nursing, and also in collaborating with other members of the training program. Although participation in the training program was voluntary, the respective PNA chapters across the country were encouraged to send their representatives who could later be tapped as local disaster coordinators. The training costs including the training materials, were fully subsidized by the PNA since it is a national program and formed part of the annual budget of the Committee on Disaster Preparedness. The resource persons and facilitators were mostly nurses invited by the organizers for their expertise and experience in their specific nursing specialty. And the resource persons also included experts from humanitarian organizations and the national agencies. So now let's look at the nurse volunteer management. So in addition to capacity building, there are other elements that needed to be considered for an effective disaster preparedness and response. These are accreditation and certification, deployment of nurses, safety and security, collaboration, and networks. Accreditation and certification of professional training programs go through a process of review and approval by the Continuing Professional Development Council of the Philippine Board of Nursing. Participants to the training program received equivalent continuing professional development credit units, which can be accumulated for renewal of one's professional license every 3 years. However, this is not equivalent to a nursing specialty certification in disaster nursing. For deployment purposes, a database of trained nurses was created. When there was a need for a call for volunteers, this was initiated through emails and social media such as Facebook. Volunteers were linked to the team leaders or point persons in charge of the mission for further instructions, including briefing and debriefing, and a post-deployment report at the end of the health or medical mission. One of the critical functions in disaster management is the management of safety and security, which, according to the WHO, covers the casualties and survivors, the care providers, including oneself, and the environment. The Department of Health recommended that volunteer groups should be self-sufficient in order to ensure safe and effective disaster response and delivery of health services. Volunteers were required to receive pre and post deployment orientation in order to clarify roles and tasks, establish communication with the PNA throughout the deployment, determine reporting and evaluation post-activity, and ensure personal psychological safety and readiness of volunteers for the activity. The organizers cannot provide for logistical support. Thus, deployment of the volunteer nurses in disaster-stricken areas were specifically coordinated with local and or international partners. The PNA National Office or the PNA chapter involved facilitated the coordination where needed. They coordinated with the local civil societies or organizations, the provincial disaster risk reduction councils of the local government units, the regional offices of the Department of Health, and other international humanitarian organizations. As you can see, this is where collaboration and networks come into play. Responding adequately and effectively, especially in large-scale disasters, requires coordination and multi-sector collaboration. This has to be established during the pre-disaster or preparedness stage among various stakeholders. During the training workshop, the participants were tasked to identify local counterparts of these organizations to network and establish partnership. They were encouraged to prioritize local health official members of the Provincial Disaster Risk Reduction Management Council and non-government organizations working in their communities. It proved very helpful for many of them, particularly when disaster occurred in their communities. Partnerships and networks should be established at all levels, at the national, regional, and local levels. Now let's look at the impact of the national training program. The training program was primarily envisioned to equip potential nurse leaders with competencies in disaster preparedness and management so that they can share or replicate the program in the respective PNA chapters, serve as disaster coordinators of the PNA, mount a mobilization for nurse volunteers for disaster response, and establish networks with stakeholders in disaster management. Participation in disaster response, recovery, and rehabilitation were specifically highlighted when several provinces were struck by strong typhoons, such as Typhoon Washi in 2011 and Typhoon Pablo in 2012. Both struck provinces in the Mindanao region. Then the more known Typhoon Haiyan in 2013, which devastated several provinces as it coursed through the Visayan region. Because it was national in scope, there were several mobilizations of nurse volunteers organized in provinces less affected by the typhoon. Two groups of nurse volunteers were separately deployed following the Taal volcano eruption in early 2020. And these were made possible through a collaborative work with partner institutions in the media. Close collaboration with local government units were established, and the focus of the nurses' roles were on water and sanitation and hygiene, health, nutrition, and psychosocial support. Then in 2015, the participants were invited to attend a nurses summit for them to share their best practices in disaster management. It was also an opportunity for them to receive updates and brush up on other disaster nursing skills. From 2010 to 2017, we averaged 36 participants per year, coming from different regions of the country. We have so far covered the major cities and provinces with major natural hazards. Post-training activities focused on initiating a training program within their locale in the form of seminars and workshops, provision of direct services in disaster response, recovery, and rehabilitation, and establishment of networks. There are issues, barriers, and gaps faced by the training program. The main issue encountered by the program was the lack of financial sustainability. It was important in order to ensure continuity of the program at the national level. For many nurses, funding for their training is an important concern since oftentimes these are out-of-pocket expenses which many could not afford. Several of those who went through the training program have left the country for professional and family reasons. This is what we commonly refer to as the brain drain or human capital flight. And as a result, this created a void in disaster coordinator positions. There were also difficulties in meeting other logistical requirements and also changes in personal and organizational priorities. Okay, in conclusion, this case study presented the development and implementation of a training program for nurse trainers in disaster preparedness and management. It was national in scope in terms of target participants. We were able to reach participants from the different, across the different regions in the Philippines. It used evidence-based competency frameworks and resources for the delivery of the content, including the choice of learning, teaching strategies or activities. It was seen to be relevant to current local and national needs. It contributed to the participants' personal and professional development. It provided a venue for collaboration with local and international networks, and it presented strategies that could help improve workforce development in health EDRM. We also mentioned issues and barriers, and this remained present. At the same time, this could be addressed through the following: proactive leadership, continued advocacy for nurses' roles in disaster management, adoption of a multi-professional or multi-sectoral approach in training programs, widen networks and collaborations, and develop funding mechanisms to ensure the program's sustainability. So the team would like to present the following recommendations from this case study. First is advocate for national nursing organizations across countries to lead in disaster preparedness of nurses by embedding a training program in disaster management as a core organization-wide program. This provides a strong case for public policy and funding initiatives for nurses in disaster management. And the ICN Disaster Nursing Framework and core competencies can serve as an important framework, especially for those who are still in the development stage. The training development program in disaster management takes an all hazards approach. There is a need to update the program in order to integrate emerging and re-emerging infectious diseases. A third recommendation is to increase the range of networks and collaboration within the national and international scope. To increase networks and collaboration, particularly among those already involved in disaster management, organizations involved in relief operations, and also those engaged in training, whether these are formal or non-formal institutions. The fourth recommendation is to involve other nursing specialty organizations, like the Maternal and Child Nursing Specialty Group and the Gerontology Nursing Specialty Group in crafting specific training activities focused on disaster preparedness or care of specific or vulnerable populations during disasters. And the last recommendation is to engage in multi-hazard interprofessional training programs to strengthen coordination of activities throughout the disaster continuum. I think this is my last slide. Thank you very much. Mabuhay. These are my references.
Thank you, Bettina, for the very comprehensive description of the case. And personally, I was in the Philippines the first week after Typhoon Haiyan, working with the IFRC, the Federation. And at that time, we worked very closely with the Philippine Red Cross nurses, and they were certainly very professional and very resilient, and I learned a lot from them. In the interest of time, Bettina, maybe I can just pose one question to you. Since COVID-19, we've seen, nurses often have to respond to multiple emergencies, especially in Philippines. I think there are risks of natural hazards as well as other hazards that are being faced. In your experience for the past year or so, how does the multi-hazard curriculum working so far in face of COVID-19? Is there still silos to be broken, or is everything working smoothly? Just want your quick thoughts on that.
Thank you very much, Kevin, for that question. And thank you again for inviting me for this webinar and sharing our experiences here in the Philippines. Well, actually, with the COVID-19, there's one big area that we see that we need to put more time for dissemination, information, and also education, especially among nurses. And this is in infection control and readiness for the pandemic. I think since 2020, our nurses, especially, the medical team, the healthcare team has really provided their best effort in order to respond effectively to the rise of COVID cases in the country. But when it comes to training, again, that's one area that not only in the undergraduate, but also among professional nurses, that we see that there's really a big area that we need to respond to. And many of the organizations or hospitals even provided their own training in order to to fill in the gap when it comes to that particular area. And it's a multi-hazard approach, but again, we see that training plays a very important role in this. And now I think even in the nursing organizations, among the nursing supervisors and other related organizations, they're already crafting training programs that will focus not only in natural hazards, but also in emerging and re-emerging infectious diseases. And I think this is the focus that we will be having now, especially in not only in the professional areas, but also in the undergraduate programs to really address these particular concerns. Thank you.
Thank you, Bettina, and thank you for leading on this very important case and sharing your experience from the Philippine Nurses Association. I think we have a lot to learn from your experience. Thank you.
Thank you.